cardiologist has referred you to a heart surgeon for coronary artery bypass grafting, CABG, or a valve procedure. Your procedure has been scheduled, and now we will review what to expect before, during, and after your hospital stay here at DHR Health. Coronary artery bypass grafting is needed when the arteries in your heart are narrowed or blocked. This is usually the result of plaque buildup in the arterial wall called atherosclerosis. The coronary arteries supply the heart muscle with blood and nutrients needed to pump blood throughout your body. A vein from your leg or an artery from your chest or wrist are used to bypass the damaged area of the coronary artery. This is called a coronary bypass. Valve surgery is needed when one of your valves is damaged or diseased and does not work properly. This can be due to stenosis, also known as stiffness, or valve regurgitation, where leaking occurs. Heart valves keep your blood flowing through the heart in the right direction. Your heart surgeon might need to repair or replace your damaged heart valve and will discuss the best procedure for you. Usually, these procedures are completed using a heart-lung machine that pumps your blood while your heart is stopped. Before your procedure, talk to your healthcare provider regarding the following: allergies to drugs, iodine, food, tape, or latex, all medications you are taking, including blood thinners, steroids, thyroid medications, blood pressure medications, diabetic medications, over-the-counter medications, and herbal supplements or teas, any past surgeries, and any problems you or your family have had with anesthesia, any medical conditions, any bleeding disorders. If you smoke, drink alcohol, or use illicit drugs, if you are pregnant or think you might be pregnant. The heart surgeon will tell you which meds to stop and which meds can be taken with a small sip of water the morning of your surgery. Ask questions. Registration process. We'll need to go to the hospital main entrance and go to registration. Make sure you bring your insurance information and your orders from the heart surgeon. Once your registration process is complete, you will be directed to different areas to complete your pre-operative process. This will include getting labs drawn, performing a pulmonary function test, getting a chest x-ray, and other studies as requested by your surgeon. This occurs within 3 days of your surgical procedure. You will then go to the PAT area. This is pre-admission teaching and testing. Bring all the medications you are taking, and the nurse will document them in the computer. The nurse will ensure you have completed the required tests. Instructions for preparing for your surgery will be given. You will be required to sign a consent for the procedure. Make sure you follow these instructions. If you smoke, stop immediately. Smoking can hinder your healing. You will be given a specific time to arrive for your surgery. Ensure you are on time. Do not eat or drink anything after midnight the day of your surgery. You may take specific drugs with a small sip of water the morning of surgery as directed by your surgeon. You will shower the evening before and the morning of surgery with chlorhexidrine germ-killing soap. Do not shave your chest or legs. These areas will be clipped the morning of your surgery. Do not use any lotions or powders. Day of surgery. Remove all jewelry and leave at home. Do not bring money or valuables. To ensure patient privacy and ease communication about the patient's status, please designate one family spokesperson to receive information. We ask that the designated spokesperson keep family and friends updated on their loved one's condition. Let the staff know the location in the hospital where your family will be waiting. You will go to the pre-operative holding area at the time instructed. You will change into a hospital gown and empty your bladder. The anesthesiologist and heart surgeon will visit you in this area. Ask any questions or voice any concerns to your providers at the time they visit. You will go to the operating room on a stretcher. The anesthesiologist will start your sedation and a breathing tube will be placed. While you are asleep, a tube will be placed into your bladder, an IV will be inserted into your arm, and other lines will be placed in your neck area. A line will be placed in an artery on your wrist to monitor your blood pressure. These are necessary for monitoring during your procedure. An incision will be made on your chest and veins removed from your leg if you are having a bypass procedure. Expect your surgery to be 4 to 6 hours. Tubes will be placed in your chest and connected to suction to help drain fluid and reinflate your lungs. After your procedure is done, Your sternum will be closed with special wires to hold your bone together for healing. A dressing will be applied to your chest. A dressing and ACE wraps will be applied to your legs. Your surgeon will talk to your family. A warming blanket will be placed over you to help regulate your temperature. Your operating room team will transport you to the intensive care unit, ICU. After procedure. After you arrive in the ICU, expect 1 to 2 hours before the family is allowed to visit. Visiting time is limited while in the ICU. Do not have any family members feeling ill come to see you. Your stay in the ICU is usually 1 to 2 days. Expect many lines and tubes to be connected to you, as they will be necessary to continuously monitor your progress. A tube in your throat will be connected to a breathing machine. While this tube is in place, you will not be able to talk. Communicate by nodding yes or no to questions. This tube will be removed as soon as it is safe, and you can expect your throat to be sore after. After the breathing tube is removed, your nurse and respiratory therapist will have you take deep breaths and cough. This will be some discomfort with the breathing and coughing exercises. However, it's important to clear the phlegm in the airways to prevent complications. A heart pillow will be given to you to splint your chest when moving or coughing to help with this discomfort. Remember to hug your heart. You will need to start using your incentive spirometry, or IS, as soon as you are able to, and continue using it 10 times per hour while you are awake. This is important to expand your lungs and help prevent pneumonia. Using your IS should be done throughout your hospital stay. Your nurse and respiratory therapist will help you with this. Once the breathing tube is out and you are awake and stable, a liquid diet will be started and advanced when you can handle more solid foods. You'll be given pain medication to help control your pain. Report pain before it becomes severe. Medications will be given through your IV during the immediate post-operative period and changed to oral when tolerated. The healthcare team will constantly be monitoring you while in the ICU. Day after procedure. You will get out of bed and take a few steps to the chair the morning after surgery. Log rolling will be done when you get out of bed. Remember to hug your heart pillow. Sternal precautions start immediately. No pulling or pushing on your arms. Use that heart pillow. Protect that sternum. Elevate your legs when you are up in the chair. Remember to ask for pain medications before your pain gets too severe. The ACE wraps on your legs will be removed and compression stockings will be placed. Your compression device will still be used. Your catheter in your bladder should be removed. Care during stay. You will be moved to the step-down or telemetry unit when you no longer require ICU care. Usually this occurs by the second day after surgery. Lines and tubes will be removed as determined by your surgical team. Your chest dressing will be removed on the second day. Some patients will have a negative pressure wound system over your chest incision, which helps decrease fluid buildup. Your activity will increase. You will work with physical therapy and be walking in the hallway 3 times a day prior to discharge. It is expected that you are up in the chair for meals. Do not get out of bed without assistance. Compression stockings still need to be worn. Do not cross your legs. Remember to cough up your phlegm, splint your chest, and hug your heart pillow. Use your IS 10 times every hour while awake. Call for assistance using your call light. Report your pain before it becomes too severe. Report if you have feelings of sadness. These are normal feelings following major surgery and often can be related to the anesthesia and medications. You will shower prior to discharge, but do not use water that is too hot. Make sure you have had a bowel movement before discharge. Do not strain. Case managers will talk to you about your discharge plan starting the day after surgery. Our goal is for you to return home within 4 to 5 days after your surgery. Other options may be necessary depending on your recovery progress. Discharge instructions. Follow these instructions once you are discharged. Your nurse will review your medications with you. Make sure you take your medications as prescribed. Eat healthy. Keep your incisions clean and dry. Wash with soap and water. No tub baths. Monitor your incision for signs of infection, redness, swelling, or drainage. Walk often for short intervals, 4 to 6 times a day. Gradually increase your activity as tolerated. When you feel stronger, go outside and walk to the mailbox and back, but not during the heat of the day. Do not allow any visitors at your home who are ill. Hand washing is important. Make sure your hands are washed. Cough up your phlegm, hug your heart pillow. Continue using your incentive spirometry 10 times every hour while you're awake for 2 weeks. Continue sternal precautions. No pulling, pushing on arms, or lifting over 10 pounds for 6 weeks. Do not push on your arms when getting up from the toilet or chair. Do not do any activity that makes you strain. When leaving the hospital, sit in the back seat and place the seatbelt over your heart pillow. If a vein was taken from your leg for bypass, this leg may swell and be painful. This is a normal process. Remember to elevate your legs while sitting. No driving for 4 weeks. Do not smoke or be around secondhand smoke. Weigh yourself daily at the same time and record your weight in a notebook. Participate in cardiac rehabilitation as directed by your healthcare provider. What to report to your physician. Fever over 101 degrees Fahrenheit. Increased redness, swelling, or pain around any incision. Pus or a bad smell coming from any incision or your incision feels warm. Increased swelling in your ankle or legs. You gain 5 pounds or more in 1 week. When to get help right away. You have chest pain that spreads to your jaw or arms. You develop shortness of breath. You develop a fast or irregular heart rate. You have symptoms of a stroke. DHR Health hopes this information was beneficial for you to have a prompt recovery.